And so what initially started off as, let's try to identify people who were health home eligible, soon snowballed into a really large social determinants of health project that had us not only getting agreement on what the screener would look like, getting it into Epic, but then also having the staff on the back end who would be able to deal with patients who screened positive. And since April of 2018, when we rolled out the comprehensive tool, we've screened over 25,000 patients so far. We're screening at about 2,000 to 3,000 patients a month across the ambulatory primary care practices. Importantly, in my role as the Vice President of Community and Population Health, we've been able to use the data on these 25,000 screens to hotspot areas. So we understand it not only patient by patient, but we're also starting to understand issues like food security at the census tract level. Frankly, we could do it at the building level. So that helps us look at issues like what is happening in this particular area. Why is this area lighting up for food insecurity? For instance, each of our hospitals is either squarely in or right adjacent to a food insecurity hotspot. And so that starts to beg the question, what can the hospital do to help bring about more resources in its own footprint? We're not even talking about having to drive 3 miles down the road. We're talking about right here, right now. What can we do as a health system to augment the capacity of the food providers, the food pantries and others, to be able to handle the food insecurity needs of our patients? And when you think about being able to take social determinants of health issues like that and to map them in that kind of geographic way, it really does add another lever for action.